Hi, today we'll try to talk about the prognosis of the treatment of hypertension, that is high blood pressure, using homeopathy. Hypertension or high blood pressure is almost like a pandemic, and people world over suffer with this. And it is a serious disease condition, and it requires close monitoring, treatment, and strategic changes in one's lifestyle as well as a part of the therapy. My name is Dr. Rajesh Shah. I am a director of Life Force, and we treat patients from across the world. Hypertension is a disease having multiple factors as its probable cause, and there is no one single cause behind it. And it is difficult disease, it is resistant disease, it is a progressive condition, and it can affect essentially various vital organs in the body, not restricted to the heart alone. Conventionally, high blood pressure is treated using the conventional medicines, which are anti-hypertensive medicines like beta blockers or calcium channel blockers or ACE inhibitors. When it comes to homeopathy, at Life Force, we have been evaluating the efficacy of homeopathy for high blood pressure patients in several cases in a strategic manner to see how homeopathy responds. As a matter of fact, we undertake only those patients of hypertension who are recently detected cases or those who have been diagnosed having high blood pressure since less than 2 years approximately, and those who are on anti-hypertensive medicines for less than 2 years. We want to see how homeopathy works for these cases, and I would like to share some of the clinical findings. In our experience, we have observed that homeopathic medicines work reasonably well for many cases of hypertension, if not all. Especially early detected cases, when they are put on homeopathic medicine, they show good results. Of course, we also recommend lifestyle changes along with the medical treatment that we offer. We also plan to very strategically reduce the dose of anti-hypertensive medicines if the patient is already consuming them very slowly over time. And in that process, we monitor the cardiovascular parameters very closely to avoid any sudden surge of high blood pressure creating complications. And we slowly reduce the conventional medicine and see that blood pressure is maintained properly or not. If not, then we may probably increase the dose and so on. There's a method which we use to slowly taper off the other medications. We cannot claim that we have succeeded in 100% of the cases, but we can share that many of these patients, closely 20 to 30% of the cases, significant results, recovery, and success in stopping anti-hypertensive medicines for these patients. Is homeopathy recommended for the cases of hypertension? In our experience, which is limited to around close to 500 cases of closely monitored patients of high blood pressure over a couple of decades and longer, we can say that homeopathy should be tried in most cases of high blood pressure or hypertension, and it requires close monitoring, because if you reduce the anti-hypertensive medicines, there may not be other symptoms. The patient may be asymptomatic and the pressure may remain normal for around 10 to 12 days, but suddenly there may be an increase of blood pressure after 12 or 13 days. So that has to be kept in mind, and a close monitoring is very important in changing the line of treatment and in reducing the conventional anti-hypertensive medicines. Some people may ask, why should we use homeopathy for the cases of hypertension, because the conventional medicine is taking care of that? Well, it is not exactly true. Conventional medicine is very effective for many cases of high blood pressure. However, all cases, they do not respond equally well to the conventional treatment. Not only that, the conventional treatment for high blood pressure is almost lifelong, and they are known to produce many adverse effects. Sometimes the bad effects of the medicine are more than the symptoms that hypertension itself would give. So there is always a scope, there is a room to check other options for managing high blood pressure, which requires a lifelong management. So one must be open to check options such as homeopathy. We require, of course, much more research in this space to be able to identify, in order to decide the exact protocol and the right kind of medications which are more useful in managing the cases of hypertension. How much time would homeopathic medicines take to treat hypertension? Well, being a chronic condition and progressive disease, it's difficult to define the timeline. However, we can say that in around 3 to 4 months' time, we should see significant indications suggesting that the medicine is working and reducing the high blood pressure parameters, especially diastolic blood pressure. And in about 6 months' time, we should be able to definitely reduce the conventional anti-hypertensive medicines and manage only with homeopathy. One has to be open-minded to explore options like that of homeopathy in all those chronic conditions, especially which are not 100% manageable with any one single therapy. Hypertension is one of those conditions in which we have to find alternative measures to manage this disease in a better way. I hope this video helps the lay people as well as the practitioners and the medical students. Thank you very much.